Price gouging in the pharmaceutical industry is not necessarily new news. However, there was a story that kind of went under the radar that I wanted to bring to your attention. Back in December, the Wall Street Journal reported about price gouging in regard to a specific cancer drug that's used for a variety of individuals who have different types of cancer, like brain tumors, lung cancer, Hodgkin's lymphoma. It's been around for about 40 years, but over recent years, the price has gone up considerably. To give you an example, it was previously sold for around $50 a capsule. The same dose now costs a whopping $768.
Jesus Christ, man.
So back in 2013, the pharmaceutical company that created this drug and sold this drug had actually sold it to a new startup called NextSource Biotechnology, Biotechnology. Now, after NextSource purchased it, that's when the price gouging really started. NextSource has increased the price 9 times in less than 5 years. Prices of other doses of the drug, which the company has renamed as Gleostine, has also been increased considerably. The drug gets sold to a new pharmaceutical company, a startup, and they're like, you know what? Even though the patent on this drug has expired, no one has created the generic version, so we can go ahead and charge whatever we want. Over $760 for one dose of this drug.
So this is what crony capitalism looks like. Why? So drug companies do get patents that last for a certain amount of time. It used to be 5 years. Now, over time, they've increased that. Sometimes now it's 7 years, and for some drugs, it's even all the way up to 12 years. And that is the government saying you are not allowed to compete with these people. Now, sometimes those patents last so long that it's not economically viable to create a generic drug. Now, that's oversimplifying it. And I'm not positive as to why there wasn't a generic drug in this particular case. Okay, but the other way that you have crony capitalism affecting the drug companies is in other developed countries, they have single payer. So what does the government do? It negotiates on your behalf. So if you say, all right, I know that I make a really good profit at $50, but I'd like to charge you $750 instead, the government goes, no, I'm not gonna waste the taxpayer money paying you $750. I'm gonna negotiate, okay? In our system, this is unreal. If you don't live inside America, it's gotta be confounding to you. The government is not allowed to negotiate drug prices, even though they have enormous leverage because they buy so many drugs for Medicare and Medicaid. They literally wrote it into the law that the government must take whatever price the drug companies give. How is that possible? How could you, I mean, if it was a business and you told the business, you must pay whatever the person is charging you down the supply line, you'd be like, that's outrageous. No, I should be able to negotiate.
Right.
No, but they took that power away. Why? The drug companies are the #1 donors to politicians. And since they give so much money to the politicians let them rob us blind. One last thing that's super relevant to this is if you have single payer, everybody's covered. They don't let the sick die. That's kind of the point of insurance. But in our insane system here in America, we let people die. We let them die in the streets.
That's right.
So there are tens of millions of people who are uninsured. Now there will be more uninsured because the latest tax plan cut even more from healthcare. The Republicans now are saying they're going to cut even more from Medicaid and Medicare to make up for their tax cuts for the rich. And then on top, these guys go, well, you got cancer. You got to take this drug, otherwise you're going to die. So I can charge you whatever you like, and your government is not here to protect you. Nobody's looking out for the citizens. This is a government by the corporations, for the corporations, of the corporations.
Right, and now some might say, okay, well, even if you have the government negotiating, if there is no generic version, if there are no other competitors, then wouldn't this company still be able to charge whatever it pleases? Well, that could be the case, but remember, if the government is involved and the government sees this form of price gouging, there might be regulatory retaliation. There might be some oversight. They might look at what the actual costs are. Why is it that they're charging so much per capsule? And that could change things, right? So by the way, the chief executive of NextSource was asked about why the price has gone up so much. And here's what he had to say. He said that the price is based on development costs. Remember, this drug was already developed. It's been around for 40 years, okay? Development costs, regulatory fees, and the benefit the drug provides to patients. Okay, let's stop for a second.
Yeah.
Wait. So right there, he is confessing this drug will literally save cancer patients' lives. And so I know I can charge whatever I want for it, and they have no choice but to buy it if they want to live.
And remember, the question was about why does it cost so much? It's not that it costs that much to produce it. He's saying it costs that much because you'll die without it. Ha ha. You might as well have added that to the end of the quote. And Anna's right about the development costs. Look, development costs are a real thing, and that's why these drugs get patents, and they have patents in a lot of parts of the world. So we understand that concept. Whether the patent has to be 12 years in some cases is a completely different issue. And in this case, you developed and made up your costs decades ago. So I understand it as a concept. For this particular drug, you can't say, oh, I still haven't made up my development costs. Golly gee, I haven't even made a profit yet. That is preposterous. You know that's not true. You were making a profit when it was $50, let alone when it's $750.
I mean, it's amazing because Republicans will, talk about death panels when it comes to providing health insurance for Americans, as if it's, not some sort of privilege, but more of a right. But death panels already exist. The death panels are actually run by the CEOs of these pharmaceutical companies who get to decide how much they charge you for these drugs. They get to, price them at exorbitant amounts. And if you don't have the money to pay for it, well, too bad, you get to die. That's what you get in the United States of America. The richest country, the most productive country, that's what you get. It's pathetic. And it's amazing that there are this story, by the way, again, I wanna reiterate this. It was published in December and no one talked about it. The only reason why I found out about it was because it was republished by a different news organization and it came across my desk. And I'm like, how do people not know about this? Why aren't people outraged about this?
Well, did it come in the form of a tweet? Because if it didn't, cable news can't be bothered with it. It has to do with real issues. And by the way, it's putting the kidding aside about cable news. Who are the top advertisers on cable news? Oh, right, pharmaceutical companies. Are you having trouble getting an erection because you're 89 years old and you watch cable news? Well, don't worry, here's a drug company who's gonna give millions of dollars in advertising. They're not gonna touch those guys. The politicians get paid by them, the mainstream media gets paid by them, and lo and behold, look at that, the politicians don't do anything and the media doesn't cover it. Final thing for you guys, I want you to understand, this is not capitalism, this is crony capitalism. So I am not in favor of setting prices. So we can get into debates about that, but I think price controls are a bad idea, and I think they pervert the market, and it winds up hurting the middle class and the poor as well. Okay, but put that debate aside. I want you to understand something. This is not price setting. It is normal in a free market to set limits so that there is not price gouging. So I'll give you an easy example. A natural disaster happens, they run out of water and food. Now, somebody could go in and go, now water is no longer $1 per bottle, it's $100 per bottle or $1,000 per bottle, and if you don't have it, you're gonna die and your kids are gonna die. Well, the government steps in and says you're not allowed to take advantage of a situation like that. That is not price setting, that's price gouging, and we will not allow it because we are here to protect our citizens. Because it's supposed to be a democracy where our representatives represent us and look out for us. Unfortunately, we've lost that in this country because we've allowed unlimited legalized bribery. You just watched a video by the Young Turks, the home of the revolution. If you'd like to get the full show, come join us and become a member. tytnetwork.com/join.